team. I have a short presentation for you all. I'll share my, Omar, if I could have screen sharing privileges. I'll go over kind of the current COVID landscape, as well as give some updates on the available boosters, and then we'll dive into some monkeypox updates, and then of course touch on polio, and then answer any questions that you all may have. So with that, you all can see my screen?
Yes.
Great. Okay. So this is a deck that we use for weekly briefings with elected officials. It's updated every Thursday. So the data that's in here may be slightly outdated as far as the actual numbers are concerned. But in terms of community transmission, we have seen, we saw a spike earlier in the summer, due to people traveling, spending more time outside. A lot of people change their perception of their risk of COVID. And then, thankfully, we saw a pretty steady decline throughout July and August. There is a slight uptick. You see the highest line here is actually Staten Island. So these data are based on rates per 100,000. And so, we do see a higher number of cases per 100,000 people in Staten Island. It's not as dense. There's a lot of reasons for some reasons why we see this uptick. However, I actually checked the data earlier today, and it has now decreased as well. So most indicators citywide are trending in the right direction. So that's a positive sign, especially as we are entering flu season. The weather's getting colder. We would expect people to begin gathering indoors more often. So in terms of the biggest COVID updates, the bivalent booster was recently approved by the FDA and is recommended by both the health department and CDC. Bivalent just means that it's tailored to specifically target the Omicron variants and subvariants. Those variants actually make up nearly all the cases that we see nowadays, and have really been seeing for much of this year. If you all remember back in the late winter of this year with the large Omicron surge around Christmas and New Year's, since then, largely a vast majority of the cases have been of the Omicron variants and subvariants. So anyone who's 18 or older is eligible for the Moderna booster. Anyone who's 12 or older is eligible for the Pfizer bivalent booster. You can get either one regardless of what you received during your primary series. And of course, we have locations where you can receive these boosters available on our website, nyc.gov/vaccine finder. You can receive your COVID vaccine, your COVID booster at the same time as your flu shot. There's absolutely no risk involved with doing that. If you're a person that wants to be efficient, there you go. You can get both at the same time. So in terms of vaccine eligibility for all vaccines, we're looking at anyone 6 months and older. Again, specific locations are available on vaccinefinder.nyc.gov, or you can call the number that's listed above, and I can share that later as well if people don't have a chance to write it down. As always, vaccines are free regardless of insurance status, regardless of immigration status. And we are still offering in-home vaccinations, but they are only for people who are unable to leave their home. And again, you can sign up for this via the link and the telephone number. So this is just a quick snapshot of the vaccination data citywide. On the left side is adults, on the right side is children. So, as in terms of primary series, we've done very well as a city. We are at about 90% for adults have receiving their primary series, which is, really, really good, especially, compared to, some other states and other large cities in the United States. It's very, very job well done from, the health department side, from the community side. When we look at boosters and additional doses, the story is a little bit different. We're looking at about half of people have received their booster. I also read the other day, I think it was in either the New York Times or on CNN, that a large majority of people had reported not hearing about the new bivalent boosters. And so, a lot of the work that we're doing now is around spreading awareness and making sure that people are aware and understand the resources that are available to them. And on the right side, for children, the data doesn't show as strong of a picture. We're looking at about 50% or a little less than 50% of children under the age of 18 who have received their full primary series, and even less when we look at boosters. And part of that is, adults have been eligible for the vaccine since it was available, and children weren't eligible for booster shots until very recently. I think within the last 6 months or so, or 6 months to a year. So, there is some time for that to catch up. But of course, our message remains the same. We want to encourage people to vaccinate not only themselves, but also their family members and children. And of course, if you're eligible for a booster this fall, we would encourage you to receive that as well. So in terms of testing, we still have testing locations available around the city. I do want people to be mindful that since fall of 2021, the federal funding for reimbursement of COVID tests has ended. And so we have seen some instances where community members will go to a place like, a city MD or an urgent care type of facility, and they have received bills for the PCR tests. So, we just want people to be aware of that. There's plenty of options available at city-run sites where people can be tested for free. And so we do, again, want to make people aware of the differences in costs that could occur from these tests. And thankfully, nowadays, we also have treatment for COVID-19. Of course, this is not a substitute for vaccination. There are two types of treatments available. There's the antiviral treatments, and then there's also the monoclonal antibody treatment. Both of these have a high rate of helping people recover, in quicker than they would have without the treatment. I do want to flag that we have seen over the last year or so, there is a phenomenon called bounce back infections. And this is effectively where a person either, completes their full regimen of medicine, or they don't finish it, and they'll become reinfected with COVID. Their body doesn't fight it off. And then the infection kind of resurges. And so then you're sick instead of 2 weeks, you're sick for maybe a month or longer. So we do want people to, of course, be mindful of their symptoms and, of course, be aware of how you're feeling. That way, if you need guidance or treatment from your primary care provider, you can receive that. And H&H, that is NYC Health and Hospitals, is doing a rapid test and PPE distribution program. And so these are for nonprofit, community-based and faith-based organizations. And there are certain parameters that an organization has to meet in order to be a part of this program. If you think that your organization meets these requirements, you can visit the links below. And again, I can share these later in an email with you, Omar, for you to share out with the rest of the attendees here. but we just want to make organizations aware that there are some opportunities to partner with the health departments and the health and hospitals in order to distribute test kits and PPE. So that's all for COVID. The main points that I just want to impress upon everyone is that the bivalent boosters are available. And, as I said before, with things getting colder, we do expect, or, one would expect there's a possibility that there could be some increases in the fall. I wouldn't expect it to be, large surges like we've seen before, given the amount of people that are vaccinated, and given, some of the safety precautions that a lot of us have been taking. However, in the event that there is a surge in the fall or winter, having an extra layer of protection like the booster or the flu shot would definitely be helpful. So I'm going to go right into the monkeypox updates, and then I'll take questions at the end. So before I go into the slides here, I just want to let everybody know that New York State there was an emergency declaration to classify monkeypox as an STI. And the reason for this is that minors, which are people under the age of 18, do not need parental consent to seek care for sexually transmitted infections. However, for monkeypox, you needed consent from a parent or guardian if the person was under the age of 18. This is just a temporary change, just so people can seek treatment and get vaccinated. However, it is important to note that it has temporarily been classified as an STI. And in addition to that, the health department at the city level, we have decided to change the name to formally recognize monkeypox as MPV. And so, usually, this kind of declaration would come from either CDC or WHO, the World Health Organization. We had petitioned both of those governing bodies to make a name change, but nothing happened. So we've decided to change it ourselves. So throughout this presentation, I'll be referring to monkeypox as MPV. And of course, if CDC or WHO decide to change the name to something else, we would have to, of course, follow that direction. So as of last week, I think it's Thursday or Friday, we're looking at countrywide about 26,000 cases, over 26,000 cases. And then in New York City, we're looking at over 3,500 cases. Of course, these have increased since the date of these, the date that this was reported. However, the point that I want to make here is that New York City it currently makes up and has made up a large proportion of the cases nationwide. We once again, we were the one of the epicenters for COVID, and we also were again the epicenter for the MPV outbreak. The good news is that we have received a large amount of doses, vaccine doses from the federal government. That wasn't the case earlier in the summer. There was a shortage of vaccine available. And so, we really had to put pressure on the federal government to release more doses to not only New York, but other large cities that were seeing outbreaks as well. So this is a chart that it has the daily new cases of MPV here in the city. As you can see, there was a large jump during the months of July and August. But now moving into October, we've seen a really sharp decline in the amount of daily cases. Lately, the last few weeks, we've been seeing single digit daily cases, meaning less than 10. And that's a really promising sign. Earlier in the summer, we were seeing sometimes, 20, 30, even more daily cases. And so again, that's a testament to the hard work that the community has put into raising awareness about, the vaccination campaigns and other prevention methods. And so I'll dive into some cases by borough, and then we'll look at vaccination stats as well. So from this graph, you can see, as expected, Manhattan has the highest number of cases by borough, followed by Brooklyn, Bronx, and Queens. When we look at the total cases by demographic group, you can see that a large majority of the cases are people that are of the LGBTQ community. And you do see a pretty even distribution amongst Black, Hispanic, and white New Yorkers as well. So who is at risk? Throughout the summer, we were seeing large numbers of cases in social circles and networks of gay, bisexual, and other men who have sex with men, as well as transgender and non-conforming, or transgender, gender non-conforming, and non-binary people. Just because we see or observe large numbers of cases in those groups does not mean that these kinds of infections are subject to only these kinds of groups. Anyone of any sexual orientation or gender identity could be at risk for MPV. The infection itself is spread through close skin-to-skin contact, intimate contact, and sexual contact as well. And so, this is something that can affect anyone. And again, so how does it spread? It spreads with direct contact with rashes or sores of someone who has the virus. You can also, you can be exposed via contact with clothing, bedding, other items used by the person. Large respiratory droplets, that's the, coughing or sneezing. MPV is much less contagious than COVID or the flu, but that is another mode of transmission. It spreads when people have symptoms, but we still don't know when exactly, when exactly a person is contagious. But a person is contagious from the time their symptoms start until all the sores, including the scabs, have healed. So what are the symptoms? Symptoms would usually start within 2 weeks, but as much as 3 weeks after exposure. The most common symptom would be a rash or a sore. Could be all over the body or just in certain parts like the face, hands, or feet. We've also observed it inside of the mouth, genitals, or anus areas. The rashes and sores can be very itchy and painful, and they can last up to a month. Some people do report flu-like symptoms like fever, swollen lymph nodes, headaches, muscle aches, or back aches. And this may occur at the same time or before the rashes and sores. So what can we do to protect ourselves and our communities? The best way to protect yourself is to avoid sex and sexual contact with multiple or anonymous partners. Other ways to protect yourself would be to reduce the amount of sexual partners, especially if you don't know, their sexual history, or if they could potentially be at risk for MPV. Avoid sex parties, circuit parties, or other places where people may be having sex with people where they don't know their sexual history. And then, of course, talk to your sexual partners about their symptoms and their recent sexual history. So with the city actually recently opened up 30,000 new appointments for the MPV vaccine. And this happened last Friday at 4 p.m., I believe last Friday. Given the positive trend of the daily cases, because they've been increasing, we've had, as I said earlier in the summertime, we didn't have enough vaccine available to meet the demand. But now, thankfully, daily cases are down, and we were able to open up the eligibility to include people of any sexual orientation or gender identity who may have multiple anonymous sex partners or participates in group sex. People of any sexual orientation or gender identities whose sex partners are eligible, which would be the bullet above. And then anyone who knows or suspects they've been exposed to MPV in the last 2 weeks, or anyone who considers himself to be at risk through sex or other intimate contact. And so this model basically summarizes pre-exposure prophylaxis, or PrEP. Those of you who are familiar with HIV prevention may be familiar with this kind of prevention. But basically, this means that anyone who is either at risk or perceives themselves to be at risk would now be eligible to get vaccinated. And so with the new eligibility, we still do have recommendations for people who, for individuals or populations that we, would consider to be at a higher risk. I'm not going to read through all of this. I know it's a lot, but basically, it's the previous, it's a version of the previous eligibility before it was opened up to all individuals who perceived themselves to be at risk. Basically, men who have sex with men, transgender women, gender nonconforming or non-binary people. And the most important part is, especially people who have been diagnosed with an STI in the last 6 months, we would strongly recommend to consider, consider getting vaccinated. And this includes cisgender women whose sex partners are men who have sex with men, or transgender women, anyone who is taking HIV medication or living with HIV, sex workers, erotic workers, or anyone who engages in survival sex, which was, exchanging sex for money, food, shelter, or other goods, or people who anticipate having sex at a commercial event like a sex party, things of that nature. So now we have a graph of the total MPV vaccines administered. This figure, I am sure, is probably much higher, given that it's almost been a week since this data was updated. But we are looking at over 120,000, probably closer to 130,000 doses administered. And that equates to about 50,000, 60,000 people, because the vaccine series is a 2-dose vaccine, or a 2-dose series. So for vaccine distribution equity, here on the left, you can see the breakdown of individuals by borough. On the right, you can see it broken down by race and ethnicity. And then the lighter purple would be the percentage of people who are either men who have sex with men, or transgender, non-binary, gender non-conforming individuals. So again, similar to the cases, we see the highest rate of vaccines given in Manhattan, followed by Brooklyn, Queens, and then the Bronx. And then we have seen almost half of the people who have received vaccine, the MPV vaccine, are individuals who identify as white. For vaccine distribution amongst age groups, a majority of the people who have received the vaccine fall into the 25 to 44 age group, followed by 45 to 64. So what to do if you have symptoms? This is something, rashes and sores, can sometimes arise, and we don't know where they come from. But so you may get a rash or a sore and you think, oh, do I have MPV? And the most important thing is that you can do at that moment is, to get in contact with your healthcare provider. If you don't have one, you can call 311 or check out our health map at the link listed. We have trained many clinical providers on what to look for. They'll have to physically view the sore or rash, either through a photo or in person. And then a confirmatory test, a sample of the rash will need to be taken in order to test to see if a person actually does have MPV. And then we are doing contact tracing similar to COVID. Anyone who you have come into contact with or you believe may be at risk or has been exposed, we would follow up with them as well. And for care and treatment, so There are some prescription medications, TPOXX, and as well as some prescription mouthwashes or gels to help reduce the pain, itchiness, and swelling. As I said before, some of these rashes can be very painful, even if you know, they're just very painful. And so, you know, it can be very uncomfortable having to wait for these rashes to heal. So you know, different, you know, painkillers like ibuprofen or acetaminophen can help reduce the pain. Oatmeal baths, I've heard, have been, really helped with reducing the itching and pain, and sitz baths can help with the anal sores. Of course, if you're sick, always, you know, you want to stay hydrated, especially if you're experiencing diarrhea, and then keep rashes and sores clean and dry with not showering to prevent infection. And now, what can you do as an individual? Of course, you know, the DOHMH website and the CDC website will have, you know, some of the data that I shared with you tonight. We also have, you know, all of the relevant policy updates like vaccine eligibility, locations of vaccine clinics. All of that information is available on our website. You can sign up for text alerts by texting monkeypox or monkeypox ESP to the number listed above. We have palm cards that we can share with organizations to distribute amongst community members, only sharing accurate information. This was a problem earlier in the summer, you know, when we didn't know a lot about the nature of the infection and how it spread. There's a lot more, you know, accurate information out there nowadays, thankfully. So this isn't as big of a problem as what we experienced earlier in you know, when cases were higher or daily cases were higher. And destigmatize. You know, as I said before, you know, there was misinformation spreading earlier in the summer. You know, groups, some community members of or people that were a part of the LGBTQ community were facing stigma because, you know, there was misinformation spreading, and you know, people believed that this was something that only affected men who have sex with men and other gay or bisexual men. But of course, that's not the case. Anyone can be at risk for becoming infected with MPV. And of course, we, you know, going through something like an MPV infection, as well as recovering from the COVID pandemic, has led to a lot of stress, you know, dealing with loss and other, you know, difficult times. And so we want to direct anyone who needs mental health services or mental health support to NYC Well, where we have free mental health counseling in over 200 languages. And we have the phone number listed below. And we also have a website, nyc.gov/NYC-Well for more information.
Thank you so much.
Of course, thank you.
One question I have, the two treatments for COVID-19, those have to be prescribed by a physician, right? It's not something that you can go into the pharmacy.
Right, that's correct. Yeah, you'd have to see a physician, primary care provider in order to receive those medications.
Okay. All right. Thank you. Bob, I see your hand is up. I guess you have a question.
Sure, thank you. Thank you for your presentation. Two things. One is, you talked about a lot of the mitigations people can take to prevent COVID. It seems as though much of that has been set aside. There's little or no masking indoors nowadays, and you know, following CDC guidelines. And likewise, I suspect, and I really can't, I'm not sure where the data is. I suspect that testing has really dropped off tremendously, both home testing and then the type of testing that goes on, whether it's at those booths or at various testing sites. Is there any data on testing, and what do we see the effects of in society as mitigations have lessened?
So that's a really great point that you brought up. I'm sure you all remember, this time last year, before the Omicron wave, a lot of the testing sites had been shut down. We thought that, the summertime had went well, and there was no need to continue testing at such a high volume. Those facilities have since been reopened. And so, I'm currently looking up to see if I can give you some data on testing volume. But I do think that we learned from that mistake. In terms of, some of the policy that we've been seeing, there is no more mask mandate on the subway. There is no more mask mandate in a lot of indoor places. And so I think it remains to be seen whether or not that directly results to an increase in the cases that we see. As we've discussed, it is going to start getting colder, and we're going to start, people will start gathering indoors more. And so, it's reasonable to suspect that there could be an increase this fall and winter. But it really depends on, the level of protection that people have. And so, if people are up to date with their vaccines, if they receive the booster, that does add an extra layer of protection.
And so just to follow up on that, and thank you again. One of the things we learned during the height of COVID was the impact of healthcare disparities, pre-existing conditions, the inaccessibility of, or the lack of use of vaccines. I'm not quite sure we've learned our lesson, so to speak. That the issue of healthcare disparities that predispose people to worse effects from COVID or other kinds of potential pandemics still are as potent as they ever were.
Mm-hmm.
Again, from a data point of view, are we seeing an increase in more vulnerable populations to completing both the initial round, a booster, and possibly the bivariant booster as well? Or are we seeing the same vaccine hesitancy or reluctancy that we saw in prior to?
So that's a great question. I mean, I think, when you have access to resources, it's more likely that given if you have a certain level of education and you're familiar with, the way that some of these mitigation methods work, of course, people would choose to receive the vaccine or receive guidance from some of the government agencies. We have seen lower uptake in different communities. We don't have any data right now on the bivalent booster uptake, but as you saw from the presentation, booster uptake is much lower than the primary series. And so part of the reason that we were able to achieve such high percentages with the primary series is that a lot of companies, there was the public sector vaccine mandate, there was a vaccine mandate for healthcare workers. And so, these provided methods of, encouraging people to receive the vaccine, because at that time, that's what was needed. We're probably not going to go back to that kind of place. I don't expect there to be a reintroduction of any kind of mandates, for masks or for vaccines, if the data remains how it is. But increasing access and making sure that vulnerable populations have resources that they need has continued to be a struggle. As you mentioned, this is something that existed far before the COVID pandemic. And so, we do have our Center for Health Equity, where, we're trying to spread awareness in different communities around the city, and make sure that, people have the education required and needed to make, a decision about their own health. Because of course, we're not here to force anyone to do anything, but we do want to make sure that people have all the information necessary.
Thank you. Thank you.
Of course. Thanks for the questions.
Thank you. Any more questions for Mr. Johnson? Bastian, Kimberly, anyone? Thank you so much. Before you go on, Mr. Johnson, can you discuss briefly what has been going on with the polio?
Yeah, of course. So there was a state of emergency declared by the governor. This was at the state level. This is, I think, maybe 2 or 3 months old at this point. But basically, our public health engineers tested the wastewater. And so it's not drinking water, it's, sewage, basically. And in the wastewater, we found traces of polio.
No more. Thank you.
And when we see traces of polio in the wastewater, it's evidence of community transmission. The good news is that most people were vaccinated against polio at a young age. And so, in order to go to public schools, most states and cities have, these kind of vaccine mandates in place. Even there were concerns of immigrants or asylum seekers who were coming to New York who may not have been vaccinated. That's not really a huge concern for us at the moment. A lot of countries outside of the United States have pretty robust vaccination programs. Even developing countries have, pretty robust public health infrastructure in place to make sure that young children are vaccinated against diseases like polio. The main concern that we've been seeing is that parents of children are choosing not to vaccinate their kids. And so again, it is mandated for public schools, but not for private schools. And so there were some vaccination campaigns that happened over in the late summer, early fall. And just for context, the childhood vaccination rate for polio was at about, I think, around 85%. And so we were able to bump that up a few percentage points just from some of the campaigns that we've seen. Of course, again, like I said, the risk to most people is pretty low, given that most people have been vaccinated. If a person suspects that maybe they've been exposed or that they're not vaccinated, there are ways for, doctors can pull the records or, do tests to see if a person does have or has been vaccinated against polio. And if you have been exposed, you can receive a lifetime booster. And so, you receive the booster and then you don't have to worry about polio ever again. And the polio vaccine is almost, 99% effective, very, very high efficacy. And so, the main message with the resurgence of polio is that, if a person isn't vaccinated, if a child's not vaccinated, we really want to encourage them to do so, because polio is a debilitating, very dangerous virus. And, it's something that we hoped we wouldn't have to deal with anymore. So yeah, the main message there is just please get vaccinated if a person hasn't.
Thank you so much. Are there any more questions for Mr. Johnson? No. All right. Thank you so much, Mr. Johnson. I do want to thank you so much for coming here tonight and giving us a breakdown. A lot's been going on, and I do want to encourage everyone to please get vaccinated and get as much information as you can, and to please listen to the Department of Health information as to what's going on. Okay. All right, so thank you so much, Mr. Johnson, and we'll be in contact, okay?
Absolutely. Thank you so much, Omar. Thanks, everybody. Thank you for the questions. Hope you all have a great rest of your evening. Take care, everybody.
Thank you. So for next meeting, I wanted to do, there's been numerous reports of rat infestation within CB8. So I'm going to be contacting the Department of Health to come and give us a presentation. I know Assemblyman Denowitz and Councilman Denowitz, they had some workshops about rat infestation. So I'm going to invite them to come and speak at the next meeting as to what's been going on and how can we prevent this, So I wanted to ask the committee, is there any topics precisely would you guys want us to cover for next meeting? No one? Bob, I think.
So not for the next meeting, but because it may be a little bit short in time. However, I really would love to put the whole issue of healthcare disparities on the table. Something that I think is certainly here in the Bronx. There are some of the highest healthcare disparity issues, mental health issues. I know that I'll be traveling later this month with Marcus Crespo, who is now the main outreach person for Montefiore. And perhaps there's different folks that can come in and really begin to address some of these really rampant issues. Mental health is something that is playing out in so many different arenas, whether it's a rise in crime. I know that everyone likes to tack it on to bail reform, but that's just a way of getting people to look in another direction. But mental health has been also at the core of a number of hate crimes that have increased in New York City as well. So I think it's something that we really need to take a deeper look at.
Anyone else?
Hi, I'm new here. I actually just wanted to second what was just said about healthcare disparity. That's one of the reasons that I came to this meeting this evening. I was recently at Montefiore Children's Hospital in the ER, and then for like a 3-day stay with my newborn, and the disparity was just shocking to me, what I saw. And so I just, anything that I can be a part of that might be a conversation about that, or, I just want to second that.
Right. All right. So healthcare disparities and mental health issues. I'm going to see if I could I actually was going to contact Montefiore and see if they had someone to speak about mental health issues, and then try to contact someone else in the department to speak about healthcare disparities. Sebastian? 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 So I was going to contact Montefiore and see if they had someone to speak about healthcare disparities. And I don't know if you said you're new here. So CBA has a disparity racial equity committee that we have here, and she's on the chair, which is Miss Margaret Della. She's also on this committee. So hopefully next meeting, I will speak to her and see if she can come as well. And do you want to take down my email address so you send me an email so I can?
Yeah, I actually already took it down earlier when you were giving it to Kimberly, so I have it.
Right.
Yeah, and Montefiore is excellent. I just was, I just saw things firsthand that I knew existed, but saw them firsthand.
Right.
So, and healthcare disparities, Omar, is not something that's limited to one system here in the Bronx. It's everyone sort of participates in it to make the Bronx have the worst healthcare stats in New York State. Right. So I think that it's something that we can take a deeper dive into.
Right. And of course, Bob, I know you had offered sometimes, so I'm going to be calling you, see if you could provide me some speakers on that, because I know you had offered before.
Well, as the previous speaker mentioned, there is the Office of Healthcare Equities within the DOHMH that really speak to. I know that Dr. Easterling recently left. He was in charge of that, but so there may be other folks that could speak to it. I'm sure there's other folks within the DOHMH that can speak to the issue of healthcare disparities. And the other thing, and then the mental health issue is just it's off the charts. And just to understand how it impacts every aspect of life here in the community is just it's just so rampant.
Right, it's true. Sure. Kimberly, do we have anything to add? No.
No, I mean, I think this was discussed previously numerous times regarding the disparities of the healthcare system. So I agree with Mr. Kaplan. No.
Right. Okay. So I'm gonna dive deeper into it, and I'm gonna speak with our equity committee chair and see if I could get some speakers to come in and speak about it. And I'll be contacting the Department of Health also to see if I could get someone from that department to come and speak more. So please, if you have anything, email me and I'll reach out to you back and tell you what's going on. All right. So thank you so much for coming, and I appreciate you all tonight. Okay.
Thank you so much. Have a good evening. Bye-bye.
Thank you.
Good night. Good night. Good night.
Good night.
Good night.